How do you know if you have diastasis recti or split abs? Here's what I do when I do my research. I'll take 2 fingers and I'll find the belly button. And when I palpate and feel the belly button, my fingers are gonna be vertically. And I'm gonna see if there is a separation between this rectus abdominis. And if you've only had one child, odds are good, if you don't have EDS, your separation will just be at the level of the belly button. Now, if you've had twins, it's just gonna go a little bit bigger. If you've had your second or third baby, you need to look 2 inches above, 2 inches below. And so you take the 2 fingers and you palpate. Now, when I'm testing in clinic, I will ask my patient who is lying down to do a sit-up and kind of curl up. And when that happens, if you have diastasis recti, the rectus abdominis will go and it'll kind of come open. And this diastasis recti sometimes can do one of 2 things. There can be a doming, like an alien coming out of your stomach, or there's like a great valley, which is called invagination. And these 2 things are technically not very sightly. They're not very sinister, but what we do want is for you to have abdominal strength. So let's check your abs. So I want you to lie on your back and get your 2 fingers ready to go by your belly button. So you're gonna find your belly button and your fingers are not gonna be vertical, like I said, and you're gonna try to do a sit-up. And can you put your fingers between and you feel your muscles go apart? Or do you feel the muscles come together? Now listen, my belly's still mushy because I'm perimenopause and fighting all this stuff. But if I stop doing my abrehab, I will have my diastasis recti come back and I will have significant doming and get weakness. If you want to check out my ebook at the top of my page, it is my protocol for diastasis rehab and this abrehab, this diastasis recti, we are looking at controlling the integrity of your linea alba. A couple things we work on: breathing, drawing your abdomen in and doing a curl up, holding 5 seconds and slowly lowering down. We care about the quality of your muscle. If you have diastasis recti, we don't want you to freak out. Generally, it's not painful. It's usually just kind of unsightly, and cosmetically, we don't like what it looks like, and it is not going to technically hurt you. It just doesn't help you be strong, and I want you to be strong. When I work with my patients in clinic, I notice women, when they go to sit up from my table, kind of do this whole little whoop, like around. They don't just curl back, and they don't just sit up because they don't have the strength in the rectus abdominis. But they were also taught they weren't supposed to do a curl up because curl ups were bad, but curl ups are not the devil.